Hey chiropractors, Dr. Charlie here from ProCredits. The chiropractic adjustment is very powerful, but why? What exactly happens from the adjustment to the brain and the overall body? ProCredits offers two great modules on the neurology of the subluxation at ProCreditsCE.com. Here's an excerpt from one of those modules. Enjoy.
This next slide will show you the importance of removing the subluxation with a chiropractic adjustment. First, we must define a subluxation. If we asked 100 different chiropractors their definition of a subluxation, we may get 100 different definitions. However, one commonality amongst all those definitions would probably be that when you have a subluxation, you usually have decreased movement or fixation of the joint. Now, these spinal joints, these facet joints, are typically synovial joints, which means that they have a synovial membrane with synovial fluid between them to allow motion of the spine. Synovial fluid is produced through proper movement of the joint. So if we don't have proper movement of the joint, we do not create any synovial fluid. If you don't have enough synovial fluid in the joint, it will lead to decreased mechanoreception input coming from that joint into the spinal cord. Here's how. Looking at the subluxation, we have decreased mechanoreceptor input, which could lead to disafferentation. The first way we have decreased mechanoreceptor input is simply because we have decreased joint movement. The joint doesn't move, there's less mechanoreceptors being fired off. Those mechanoreceptors would not stimulate the A beta fibers, which will carry that mechanoreceptor input or that mechanoreceptor sensation into the posterior horn of the cord. And we showed you in previous slides how important that is. Well, as we said, if we have decreased joint movement, we have decreased synovial fluid production. Therefore, we're going to have decreased pressure in the joint space, which means that the baroreceptors, which are mechanoreceptors that are found within the joint, will not fire off because they will not sense the pressure being stimulated by the increased synovial fluid. So our baroreceptors will decrease, or the sensation or input from the baroreceptors will decrease, and thereby leading to another decrease in mechanoreceptor input from that joint. Finally, if we have decreased synovial fluid, the joint space is going to be smaller, and therefore we have decreased amount of stimulation of the proprioceptors, which is another decrease of mechanoreceptor input coming from that joint into the posterior horn of the cord. Remember how we said we have decreased mechanoreception, we're going to have increased nociception, or the sensation of pain. This is how the subluxation can cause decreased mechanoreception, thereby causing increased pain, amongst many other things. So this slide will show you the increased other things that may happen with a subluxation. So if you remember here, if we have a subluxation, we have decreased amount of mechanoreception, which means we're going to increase our A delta and C fibers, which carry nociception. So we have increased nociception coming in. As we said already from the previous slide, increased nociception is going to increase our pain in that area. Now, increased nociception at that level doesn't even have to go up to the brain. At that level, remember how we could have two reflexes. We could have a reflex stimulating sympathetic hyperactivity, which means we will cause vasoconstriction to the viscera, because when we increase our sympathetics, we have to get blood to our heart and to our muscles and away from other areas that don't need that blood when we have a sympathetic response. Remember, sympathetic is fight or flight. So we want our blood to go to our heart and to go to our leg muscles so we could either stay and fight or we could turn and run. Well, to do that, in order to keep our blood pressure constant, if we increase the blood to our heart and to our muscles, then we have to decrease that blood to areas that don't need it. And some areas that don't need it during that fight or flight may be our digestive tract, or maybe our kidneys, so on and so forth. So therefore, by having a subluxation and increasing the sympathetic hyperactivity due to this nociceptive bombardment that we spoke about earlier, we can have visceral vasoconstriction, meaning we could have less blood going to the viscera. We have less blood, we have less oxygen going to the viscera. In Robbins' textbook on pathology, he stated within the first chapter the number one cause of visceral disease is hypoxia, or decreased oxygen to the viscera. So this is a way that a subluxation causing increased nociception can actually cause visceral vasoconstriction and visceral disease. Another place where we could reflex right here at the same level of the cord, if we have nociceptive bombardment, is we could stimulate the alpha and gamma motor neurons. So we could have reflex muscle spasm going out to that same area. So how many times have you palpated a subluxation, and where that subluxation is occurring, you might feel the paraspinal muscles in a little bit of spasm around it. Well, this is this reflex muscle spasm that's being caused by that subluxation. So there's another result of the subluxation. Now let's get into deeper sections where we have, remember we said, if we have increased nociception, that nociception will travel up to the brain on the spinal thalamic and spinal reticular tract, and along the way it may stimulate and make stops at different areas. One would be the thalamus, right, which is like the central integrator of the brain. The thalamus may send signals out to the temporal lobe, which will give that memory of pain. It may send out to the parietal cortex, which will give that feeling or the location of the pain. And it may even give out to the limbic system, which increases or gives you the hurt of pain. And all these areas can increase the feeling of depression. That's why when we see our chronic pain patients, many times their attitude, or if they're in a good mood or a bad mood, may be associated with their pain level for that day. So that's where the subluxation can affect those higher areas of the brain. Finally, the subluxation can affect the hypothalamus, and in doing so, the hypothalamus, as you know, controls many different things, but one thing it will control is the release of cortisol from the pituitary. So by stimulating the hypothalamus, we may have increased cortisol levels. Well, let's look at what increased cortisol levels may do. So as we discussed in the previous slide, a subluxation with the nociceptive bombardment can stimulate the hypothalamus, which can cause a release of cortisol or increased release of cortisol from the pituitary. Well, what is cortisol? Cortisol is actually important for us. Cortisol should be elevated in the morning, and then it should steadily decline during the day. One of the main reactions of cortisol is to actually take sugar out of our muscles and put it into the blood, because the idea is that when we wake up in the morning, we should be in a fasted state, right? If we ate dinner 12 hours previously, the way we should, then we should be in a fasted state, and our body will need sugar in our bloodstream, glucose in the blood. So the reason why cortisol is elevated in the morning is so that we can get sugar into our bloodstream, so we could wake up and do what we have to do, and then get our day on, and maybe then be able to replenish the sugar by eating some breakfast, so on and so forth. So cortisol will take sugar and increase it into our bloodstream. Now, if we don't need it there, that's not always a good thing, as we know. So by increasing our cortisol levels over time, and a chronic increase in cortisol levels, we will actually cause a decreased utilization of glucose. Well, why? Well, because as we know, the more blood sugar we have, the more sugar in our blood, the more insulin is going to be released, and the more and more we release insulin to get that sugar out of our blood and put it into the cells, well, those cells are going to become insulin resistant. That's a very hot topic right now, insulin resistance. All your weight loss formulas are talking about decreasing insulin resistance. And all that means is that the cells require more insulin to do their job. So the less insulin required, the better. Insulin, we want to keep our insulin at low levels. We don't want to burn out our pancreas, number one. Number two, whenever we have increased insulin in our system, we turn off fat burning, so it could help, it could make us gain weight. So we want to decrease our insulin. So if we're really increasing our cortisol, we're taking that sugar into the bloodstream, thereby we have to have more insulin released to get that sugar out of the bloodstream. So chronic increased cortisol levels will cause insulin resistance. It'll cause decreased bone density. It'll cause decreased collagen synthesis. So if we have a patient who's injured themselves, who has injured tendons or ligaments, and we need that collagen to come in there and to help heal those tendons and ligaments in order for them to get on their way, and we have all this increased cortisol being released, it's going to make it much more difficult for that patient to heal because they're going to have decreased collagen synthesis. Also, we'll have increased protein breakdown. So again, if we're trying to increase our muscle mass due to maybe trying to give the patient some stability by increasing their core strength and so on and so forth, and we have all this cortisol that's decreasing their muscle mass or decreasing their or increasing their protein breakdown, that's going to make it very difficult for us to do our job. And then, of course, last, increased cortisol will increase antigen penetration. So the patient is always going to be trying to fight some kind of antigen. The immune system is going to be hyperactive during times of increased cortisol. So as you can see, we want to keep our cortisol at a normal level, increased slightly in the morning, and then decreased for the rest of the day. And a subluxation will do the opposite. The subluxation will cause increased cortisol. So taking care of that subluxation, adjusting, making sure we have good joint movement is paramount to keeping our patients healthy, as you can see in these last couple of slides. So the adjustment, or putting motion back in the joint, or whatever your definition is of how you heal the patient, will increase mechanoreceptor stimulation. And we said how important that is because, number one, that'll decrease muscle spasms, which will increase range of motion. It'll decrease that sympathetic hyperactivity, which will result in a healthy viscera because the viscera is now going to get oxygen because there's not going to be vasoconstriction going to it. It's going to inhibit pain pathways. Patient's going to feel better. They'll have a decreased perception of pain. It's going to improve coordination. Remember, stimulation of mechanoreceptors stimulates the cerebellum and the basal ganglia and the cerebral cortex. So we're going to have improved coordination resulting in better biomechanics, which may lead to decreased injury in the next round. And then, of course, improved mental function due to the fact that it stimulates the basal ganglia and the cerebral cortex. So the adjustment is much more than just getting a patient out of pain, as you can see here. If we could keep movement into the joint and keep the mechanoreceptor stimulation coming from those joints, we could do wonders for their health.